Hello, and welcome to Plastic Surgery Tales, the podcast about plastic surgery. Today, we're going to share the intimate and empowering stories of those who have chosen to take this journey. In each episode, you'll hear firsthand the remarkable journeys of our patients, but not just the patients. We're going to be sitting down with some of the world-renowned plastic surgeons who have helped us change these lives. Welcome, Dr. Nosrati.
Thank you.
We are here with Plastic Surgery Tales. I'm your host, Holiday the Golden Child, and we're going to be discussing plastic surgery. You are double certified, board certified plastic surgeon and a master in BBL procedures.
Thank you.
One of my favorites, guys. This is my doctor.
One of my shining examples.
Yes. And so I want to dive into like your expertise and your experience uncovering insights and like stories exploring the fascinating world of plastic surgery.
Sounds great.
Yes.
Good. Let's do it.
So let's jump right in. First and foremost, how do you determine the ideal surgery plan for each potential candidate?
Of course. So every surgery plan starts with the patient. I need the patient to tell me what they want. I never tell a patient what I think they need because maybe what I see is not what they see. And this is their body, not my body. So first I want to know what they want, what they're interested in, and then we discuss it. If it's something I can do for them, great. If I don't think that's the right approach to what they want changed, then maybe I'll suggest a different plan or suggest what I think is the best plan. But first I want to know what their desires are, and then I'll try and tailor it to what I think would accomplish that the best.
You ever had a patient come in and just be so like forceful with like, no, this is what I want, even though you're saying you won't do it, this is what I want?
Yeah. So if a patient just has kind of unrealistic expectations or thinks that they know better, which, they do know their body better, but sometimes the surgery that they're asking for isn't going to accomplish what they want. If we're just not seeing things, eye to eye, then at that point, sometimes I say, maybe I'm not the right surgeon for you.
Maybe I'm not the right surgeon for you, or you might just get blocked. No, I'm joking. Stop calling me. What factors do you consider when customizing a surgery plan for each patient?
Right. So first you got to see, you got to look at different things on the patient layer, like their skin quality. How is their body going to react to this surgery? Is this surgery going to create a worse outcome for them, a better outcome? What previous surgeries have they had? Sometimes certain surgeries they've had before might preclude you from getting a different surgery. One of the most common things is if you get an old school gallbladder taken out, not with the cameras, but where they do it old school, where they actually cut open and go inside. They don't really do it in America. They haven't done it for a long time, but it's common in more third world countries. That might prevent you from getting a tummy tuck. So that's sometimes a discussion we have to have with the patient. Or if they have a lot of fibrosis, another liposuction might not be the best answer. So it just depends on what they've had done before and what the best approach is going to be. So you got to take the whole patient, their history, their genetics, their skin quality, and figure out what's going to give them the best outcome.
Genetics, skin quality, and the doctor's overall, I guess.
Your opinion. I mean, my opinion, using my expertise to kind of assess what's going to give them the best outcome.
What do you address at a patient's expectations? Like, meaning what a person wants, like their body goals and wish picks. Like, how do you try to accommodate that? And like, is that like make your job harder when they bring in these maybe sometimes unrealistic or realistic pictures and they're like, come on now, I can't make you look like this.
So I actually love it when patients bring in wish picks for two reasons. One, when they show me the wish pick, I can then discuss, let's say someone brings me in a wish pick and their BMI is 39 and the girl is like a, supermodel, maybe BMI like 19 and her waist is, it's a huge difference. And so I ask the patient, is this what you think you're going to look for? Or is this kind of just you're trying to give me an idea of what shape you're looking for? And if the patient responds, yeah, no, I know I'm not going to look like that, but I just want you to get an idea of the shape I'm looking for, that's great. Because I know the patient is reasonable, but this was the picture that, stood out to them. So I have an idea of what they're looking for. Not necessarily they want to look exactly like this. But then if I get a patient that comes in and says, no, this is what I want to be when I'm done, then I sit down and have a discussion and said, look, this can't be accomplished with a surgery or this is the path to get there. If there is a path to get there, I make sure that we have the same expectations. And if after all that, the patient still says, no, this is how I need to be when I'm done, then again, I might say, maybe I'm not the surgeon for you.
What's the most common wish pick that you get brought in?
It's for a BBL, and it's a patient I had actually early on here at New Life. She was a larger BMI, Black patient that had just huge result. I'd say that's the number one wish pick my patients bring in. And for a lot of patients, that is reasonable. For some patients, it's not. But it's something that I did do. So it is a reasonable thing to bring in.
We're sitting here with Dr. Nosrati, the BBL master himself.
Thank you.
What elements of surgery do you consider to be crucial for like a successful outcome?
Yeah, so I need the patient to, be buying into the process, to believe that, I'm the right doctor, because if the patient doesn't believe in me, that's just going to hurt her outcome. So we have to be both on the same page, both have the same expectations, but then I need the patient to really optimize their outcome as well. So what does that mean? That means having a good diet, high protein, low sugar, taking care of your body, staying away from any kind of nicotine, any kind of smoke. All of these can affect your outcome. And then, getting the massages or wearing the faja or following the restrictions, doing everything they can do to help optimize it and working with me to help them get to where they need to be.
You talked about smoking and all this stuff or tobacco. Listen, Dr. Nosrati is not a yes man. He postponed my surgery for almost 2 freaking days because I had tobacco in my system. And not because I was smoking it, because I was in a nightclub, guys. Can you believe that? I was in a nightclub and found out that secondhand smoke is way worse than actually smoking yourself. So this man here is all about your health becoming first, doing what's right. He's not here just to say yes, 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 yes. Even though when you get married, the man's last words and has the last day of yes, ma'am. But in this situation, he's not married to you. He is married to those tools that he is operating on. And if it does not work, it does not work. Right, doctor?
Absolutely. And your safety is my number one priority. Whatever I think is going to affect that safety, I'm going to stop the surgery until we can make it safer.
So talking about safety, just to piggyback off of that, how do you handle a patient who comes in with a lot of reservations and fears and about, the aspects of the surgery plan?
Sure. So, we do discuss what some of the risks are. This is not a riskless operation. All the surgeries just have risk. I make those clear with the AR, but I also talk about how we try to mitigate those risks. What do we do to try to make things safer? All the different steps we can take. We do lots of surgeries every day, so we're really good at the anesthesia part. We're really good at trying to make everything as safe as possible. And I explain what those things we do are so they understand what we're doing to try to increase safety. And usually that's enough to help a patient get over that fear.
What are some of the ways you make a patient feel safe and throughout the surgery plan? Like what do you propose for them to make them comfortable or like, okay, doc, I'm ready to do this?
Yeah, sure. So, if they're worried about the anesthesia, I'll have the anesthesiologist come out and talk to them, talk about all the different steps they take to make things more safe. My goal in every surgery is to make sure the patient gets through safely, makes home alive, has no real issues. And so I talk about the steps we take for that. If someone has a low hemoglobin, the blood level's low, we talk about the cell saver being used for that. If someone has a high BMI and they're getting a tummy tuck, we talk about the blood thinners we use for that. We talk about all the different things we enact based on the patient's profile and the surgery they're getting to help improve that safety.
That goes into my next question. Could you explain the importance of the post-operative care and, contributing is the word I want to use to the overall success and goal? I keep stressing surgery is 50%, post-op is the other 50%.
Absolutely.
So let us know, doc, what are you proposing, as some important post-operative?
Sure. So some of the more obvious ones is, like you said, the smoking. Stay away from any kind of smoke, secondhand smoke, marijuana smoke. All of that can really impede your healing, any kind of nicotine products. Your diet. You want to make sure you get a lot of protein in there. Your body needs protein to heal. You want to stay away from that sugary stuff that's kind of a toxin to your body. You want to get the fluids. And then if you're getting some kind of liposuction or that kind of procedure, you want to get those massages, get the swelling out. Especially for liposuction, you want to get the swelling out as fast as possible because then it lets the skin adhere down, gives you a smoother result, and just overall better appearance. All of the surgeries, no matter what, I want you walking immediately. Walking gets the blood flowing, it gets your heart pumping, it just makes your body recover faster. This is not just plastic surgery. Literally any kind of surgery, and even some orthopedic surgeries, they want you walking immediately. Walking is a huge step to your recovery, all pun intended.
Dr. Nosrati does some of the best lipo to the point I enjoy your work.
Thank you.
I know that I'm going to lay on that table, I'm going to get put to sleep, and I'm going to wake up I'm in pain, but I know Dr. Nosrati did his damn thing. And I'm always happy with your results. I think the world is happy with your results.
Thank you.
I think your contribution to why I got this ring on my finger. No, I'm just joking. But I I love your work, and I love like just your knowledge. I think a lot of my knowledge has come from how informative and how well you communicate with your patients. Like I told the other doctor, I said, if I had his phone number, I'd probably be calling him in the middle of the night, like, hey doc, my right boob is swollen. What do I do? I'm one of those people who come and like any little thing, I'm like, okay, is this right? But I think I do a pretty good job with the post-op care and getting back right.
And I want to say that your energy is also a big thing in post-op recovery. You have a great energy. You're excited about it. You're well-informed. You're always looking for ways to improve your outcome. And that is definitely helpful. Patients that are excited, that are doing well, that, are interested in their care, always do better. If you come in with a negative attitude, if you come in doubtful, people think, oh, that doesn't matter, but it does. It really changes your approach to things. It really changes. Like if something happens, you're going to have a different look on it and you're going to react differently. So having this kind of energy that you
patience.
Patience, but also just your, great positive energy really helps the outcomes.
Dance a little. It says it gets the blood flowing.
Exactly.
It gets you feeling good.
You are the ideal patient, honestly. Great canvas, great knowledge, great energy.
You got me blushing over here, Doc. You got me blushing over here. We have a few personal questions that people want to know about our surgeons, and we want to know the person behind the surgery mask.
It's good to hide behind a curtain, though.
It is. It is. But, everyone always compliments and talks about your great hair.
Oh, thank you.
Yes. So this question is not on here, but we want to know, Doc, what are you doing for this great, shiny, salt and pepper hair? Like, what do you have going? Is it Tresemme? Is it ooh la la? Like, what is it?
Honestly, it's just genetics. My dad has the exact same hair. His dad has the same hair. We just have great genetics. I think I use Dove shampoo or something. Nothing exciting. It's just good genetics.
I love it. He has great genetics, guys.
Although I did get my first gray hair at 17. So there is some plus and minuses to it.
This is real.
This is real, yeah. I don't dye my hair or anything.
Would you ever think about dyeing it black?
Every time I get my haircut here in Miami, other places not so much, but every time I go get my haircut here in Miami, the lady's like, I need to dye your hair. I'm like, no, I'm fine. Leave it alone.
You want to see this? She wants to see this other guy.
Right.
Yeah.
Every time. She's like, I'll even do it for free. So I'm like, no, I don't want you to dye my hair.
Why?
I don't know. She's very pushy. She's Cuban. I don't know.
Yeah. What's the most amusing myth about plastic surgery that you've come across?
Amusing myth. That, every single person we look at, we're going to know exactly what plastic surgery they've done. Like, we'll be watching a movie and my friends will be like, what has she done? What is this real? Is that real? And it's like, there are some people where it's very obvious, but a good plastic surgeon doesn't make, some of those results that obvious, or patients don't want to have an obvious result. They want to have a more subtle effect. And so unless I'm zoomed in, I can see the scars, or maybe I can see the befores and kind of look at sometimes it's hard to tell.
Is this one of those things I know you have a personal life, so are your friends nagging you about plastic surgery? Like when you're watching movies, like, oh, who did that? Or when you guys are out in public places, like, is that real? Like They just assume you're just...
Yes, all the time. Literally all the time.
Are your friends coming to you for plastic surgery?
They did at first, but I kind of try to make this blanket policy where I don't operate on close friends and family because... For one, there's some ethical issues, especially with family. But two, if something were, God forbid, to go wrong.
You would feel guilty.
Exactly.
You would feel guilty. Damn.
And so I do, if it's a close friend that wants surgery, I have also friends that are plastic surgeons, so I might refer them to them. And vice versa.
So you don't get mad when they go to other people, like, why didn't you come to me?
No, not at all.
No. So, Doc, I know before we go into surgery that we do these tests to make sure
drug
that...
Tests.
Yeah, drug tests,
and
right?
Nicotine. And pregnancy test.
And pregnancy. My friend, she went to go have skin tightening surgery and found out she was pregnant. After having a gastric sleeve, losing all this weight, now she's here to get the skin tightened and finds out she's pregnant. Yeah. So that's just one of the crazy stories that happens right before surgery. But tell me some of yours.
Yeah, so, one of the more crazy ones is related to cocaine. Probably once a month or once every other month, we have patients positive for cocaine, and they always say, no, I don't do cocaine. And they'll give us different excuses like, maybe my boyfriend had it on his penis and he put it in me, or maybe my boyfriend just done cocaine, then he went down on me and that's how it got in me. Or just it's always somehow the boyfriend gets it into her. It's
hilarious. Oh my God, guys, don't do cocaine.
Don't do any drugs before surgery.
Why
would you put toxins in when you're trying to have a good surgery?
I knew a girl, really pretty girl. She wanted to get breast implants, but she just couldn't stop sniffing coke.
I don't know what to say to those people.
I'm just like, do you want new tits or not, bro? I don't understand. Go
with
ahead.
pregnancy too, I mean, probably 4 or 5 times a year, we'll be the first ones to let a patient know she's pregnant. She'll have no idea.
And I know she's mad.
And I'd say about half the time, the first question is, how quickly can I come after the abortion?
And how long? What is that answer?
I tell patients to wait about 6 to 8 weeks because depending on where they are along, if they're further along, it's going to be a different answer. But if they just found out, and they get the abortion, we want to allow the body time to recover. Yeah.
If you had an abortion and you're looking to get lipo or whatever's procedure, wait 6 to 8 weeks before you come back. Whew. That's hard.
Yeah.
Yeah. Well, after you have a baby.
Yes, that's a little bit different. That's going to be a lot longer.
Because Doc, listen, I don't have any kids. I haven't pushed them out. But this is like the deciding factor of the kids. I'm ready to go surrogate route because I don't want to mess up this body that you've worked so hard on. But not to say that after surgery, I might not just snap right back.
Some people do.
That's a possibility. But let's just say hypothetically that I don't.
Okay.
Is there a way, like right after I push out the baby, you could just wheel me down the hallway to your office so that way?
So there are some plastic surgeons that do team up with a gynecologist to do surgeries at the time of like C-section.
Shut up.
But they do have a higher complication rate because the uterus is, it's not completely sterile. Well, it's also not completely sterile. So they have a higher infection rate. They have a higher, and your body is recovering from
trauma,
major trauma.
Other trauma. Yeah.
So the complication rate is higher. It's not as common. But there are surgeons that do that.
Can you deliver a baby and just work on me afterwards? Is that possible? Can you do that?
Can you?
Like if I was rich, I had Cardi B money and I called Dr. Nosrati and I said, Dr. Nosrati, I need to have this baby and I need to be snatched right after inside of a faja because in 3 weeks I got a show.
Sure. So can you? Sure. Should you? Probably not. You need to give your body some time to recover.
Okay. What? 30 days?
Okay, so the ideal answer is like 7 or 8 months. But if you're trying to get to your show and all that stuff, and I know some of these stars have actually done that, once the uterus has snapped back, then after that, you might be able to do it. And that does take a couple weeks.
Takes a couple weeks. What's your go-to karaoke song?
Oh. I don't know what my go-to is. The last one I did was Lost in Japan because I was in Japan.
Lost in Japan.
It seemed like an appropriate song to sing.
Give me like a Bon Jovi type of energy.
Really?
Yeah.
Classic rock is good.
Or Shakira.
No, I don't think I do.
No Shakira.
Her last song where it sounds like she's like having a stroke or something in the song, I can't even stand that song. But her older stuff is good.
Her older stuff, Shakira. I like her. She's cool.
Belly dancing and all that.
Yeah. If you had any superpowers, what would it be and why?
Ooh.
Mine would be invisible. And invisible and mind reading, but invisible.
So mind reading has always been an interest of mine just because I feel like it's so hard to get straight answers. Like I like to be a straight shooter with people. I don't like to hide around things. I like to tell them, what's on my mind. And I feel like that's really difficult, especially in Miami. And so I think mind reading would really help my life here just because I never really know what anyone's thinking or saying to me.
Or just get the lottery numbers.
Oh, but that wouldn't be mind reading.
Maybe.
It'd be mind control, maybe.
Mind control.
Maybe. Or immortality, so I can see us go into space travel or see what the future holds.
Invisible, so when they pick the lottery numbers, I'm there and I can change the numbers around to fit my lottery ticket.
Ooh, that's a good idea.
Yeah.
Or you could just walk into a bank vault if you're invisible and walk out with the money.
And walk out with the money, but then they would just see the money floating.
Maybe if you touch things, they become invisible too.
We're going to work on that one. What's a hidden talent you have that not many people know about?
Well, I like to go sailing a lot.
Sailing?
So I like to live places close to the water so I can go out on a sailboat.
Hopefully not Lake Lanier.
What's going on?
It says people are disappearing. It's in Georgia.
Uh-huh.
It's called Lake Lanier, and it's been known that this lady died in it with a blue dress.
Uh-huh.
And now the people who sail it and do all these things, they come up missing.
Really?
Yeah, Lake Lanier.
I wanted to look into that.
But you're sailing on the boat.
Yes, I like sailing on a boat. It's very relaxing. You don't have the sound of a motor. You just have the wind kind of whipping
like
through.
Gondola type of energy?
No, like a real sailboat.
Oh,
like with the sails and everything and going out in the ocean. And
have you ever sailed to Greece?
To Greece? No.
Through Greece?
No, I guess we didn't go. We were supposed to go, but the weather was too bad, so we couldn't.
I've heard people who go there and visit, they don't even get a hotel room. They just stay
Yeah,
on
you
the
can do a
boat.
yacht week, where you just take your sailboat and jump around from the islands. I wanted to do it in Croatia a couple of years ago, but the friends are supposed to go with bailed. And I like to have at least a couple of us that know how to sail on the boat, because if I fall off, I want someone to be able to come and get me.
Not fall off. Okay, can you swim?
Of course.
Okay.
Yes.
I need a life jacket, but if you could travel back in time, what era would you visit and why?
Oh, that's a complex question. I feel like the answer everyone's supposed to give, they can travel in time, is to go back and kill Hitler. But I think it'd be really cool to see what the Roman Empire at its height, to see how that civilization functioned. It might also be really cool to see dinosaurs alive.
Dinosaurs.
But yeah, maybe the Roman Empire.
The Roman Empire.
Yeah.
Medieval
or
times.
kill Hitler. Sorry.
Kill Hitler.
Yes. You can go to medieval times. They have those
in
shows.
Jersey.
Jersey has one. LA has one. Dallas has one.
Yeah. I would travel back to medieval times.
Yeah. Why do you like the medieval times?
I like the wardrobe. I like the wardrobe, the hair, the women wearing these corsets. And
what part of the world? Like Italy, England?
I would do more of Italy.
Italy? I'm actually reading a book right now about Leonardo da Vinci's biography, and it's essentially medieval times Italy.
Awesome.
And it's talking about how he would design all these parties and stuff. So he wasn't just an inventor; he also threw parties.
He's a creator.
He's a creator, exactly.
Yeah, you're a creator.
I try my best.
Yeah. There's an art to being a plastic, and are you cosmetic too, right?
Yeah.
To being a cosmetic and a plastic surgeon,
yes.
There's an art to what you do. There's a strategy to what you do. You have to have a lot of eye and hand coordination. This is why I was not good at basketball or soccer or pretty much any sport besides cheerleading.
I actually played lacrosse in high school. We won the state championships, and
really?
that's I had the long stick, so I had a 6-foot stick, and you got to be able to control a ball at the end of it. So that's hand-eye coordination.
Yeah, I'm bad at it. I'm even bad at not bad at driving. I'm a little blind, so it probably would never work out for me. I don't think I have any. I'm very flexible. I think with my size, people kind of underestimate that. I'm like a football player. I'm really fast and I'm flexible.
They used to make football players take ballet to get agility.
Yep.
But I guess that's an important trait to have in your previous occupation. So it's good to.
Yeah, I'm a retired exotic dancer, but I kept the talent. That didn't retire.
I'm sure your husband appreciates that.
Yes, he does. Fiance.
Sorry.
Yeah, don't push it. He ain't there yet. If you could travel, we talked about if you could travel back in time, what's the most adventurous thing you've ever done in your life?
I guess it depends on what you call adventurous. I mean, I've done some hikes where, you're like walking along the edge of a cliff, just basically holding on by a chain, and it'll be pouring rain. I've gone sailing in tropical storms. I've snuck into places where you really shouldn't be. I mean, I don't know.
You ever did Runyon Canyon in Atlanta?
Runyon Canyon in LA?
I mean, in LA. I'm sorry.
Oh, yeah, that's nothing. Yeah. Those are very mild hikes.
They're mild?
Yeah.
It's always an adventure when I do it. I'm scared to go off the cliff.
Yeah.
Yeah.
No, I used to live in LA, so I mean, Runyon and all the hikes around there, Temescal and all that area. There's plenty of hikes.
It's a good experience.
It is.
Once
it's nice
you're
to get
up,
out.
You got to figure out how to get back down. And that is a different walk.
Yeah.
Going up is the easy part.
Yeah.
Coming down is the hard part.
I actually like to run when I go downhill because I feel like it puts less stress on my knees because I'm going with it instead of trying to fight the downhill.
Instead of trying to fight it.
But you're talking about cliffs. I mean, I've been to Cliffs of Moher, all kinds of cliffs in Ireland where I'm just kind of sitting on the edge of the cliff.
Do you take those pictures?
I have pictures of it, yeah.
Ah, dope. I got to see some. If you can give me one piece of advice to your younger self, what would it be? Mine would be save, and save some more. Invest.
That is very good advice. Maybe buy Bitcoin.
Buy Bitcoin,
young, right?
Yeah, while you're young. Or create your own coin.
Yeah, I bought Bitcoin when I was in college, and I wrote the wallet number on a piece of paper. I think I had 3 or 4 Bitcoin. And back then, digital wallets weren't as common. And so you had the wallet number written down. And I think I put it in my nightstand or threw it away or something. And so
it's just floating in the metaverse.
So some dumpster in Austin has, a couple $100,000 on a piece of paper in it.
Oh, wow.
Yeah.
That sucks.
Yeah.
I don't, like I said, I would save and I would invest when I was 18.
Yeah.
Because I was working like a mule. I had 2 jobs, sneaker store, Victoria's Secret. Yeah. I was working. My parents were giving me money, birthday gifts. This is when, birthdays. So birthdays, people gave you hundreds of dollars. I always depended on my grandmother's birthday card because I always knew it was at least $1,000. Now, she wasn't cheap at all. Thanks, Grandma. A couple, and I would have saved it. I would have invested. And I think I definitely would have took over my mother's house instead of her letting her sell it.
Yeah.
I would have moved in her basement. Here's my younger self. I would have moved in her basement. I would have been the 30-year-old daughter still living in the basement because life would have been great.
Yeah.
I would have been able to save my money, give her a couple $100s,
right,
and do what I needed
and keep the house.
And
the
keep,
house
and keep
lost.
the house. Right.
So I actually, when I was in 5th grade, we did something called the stock market game, where the Houston Chronicle put out a game. It was supposed to be for middle schoolers, but they let our grade do it. We actually won it. So we beat all the other, older kids in Houston. You would invest in stocks, and then whoever had the most money at the end won. So it actually spurred me. So I actually did invest. I didn't have my own money until college, but I was actually investing in college and playing around with stuff.
Doc, when did you become rich? We want to know.
When did I become rich?
Yeah, like when did you make your first million?
Once I became a surgeon.
Really?
Yeah.
What did that feel like? What did that look like?
What happened during COVID, because I finished training before COVID, so I started, my...
Perfect timing.
Right, so there wasn't anything to do with it, right? You're just kind of stuck at home, especially in California.
I was in Mexico. I was hanging out in Tulum.
Oh, that's nice.
All of COVID.
I was in California, so I was just hiking hills. That's all you could do, and going to the beach, which is great.
Nice,
I wasn't complaining about that.
Yeah.
But you can't really spend it on much.
Can't really spend it.
Yeah.
What's the first thing you invested into?
In that game, the one that made us the most money was Pfizer.
So, Doc, when it comes to BBLs, what is the immediate steps to take for post-surgery to ensure the most smooth recovery?
Sure. So there's a couple things that are really important. One thing I always like to warn, well, let me get into the media post-op. One thing patients are going to notice, they're going to have a lot of red fluid coming down them. This is the liposuction fluid. So I want to tell patients not to freak out when they see that. But after surgery, it's not blood. It has a blood tinge to it, but it's going to look more like cranberry juice. Blood, if it comes out it's thick, and it comes out and forms clots like Jell-O. So that's how you know it's not blood. But after surgery, it's very important to wear your faja, keep the compression on, and get your massages to get that fluid out of you. You want to have a better recovery. You don't want to put any pressure on the butt. If you're going to sleep, a lot of times people do the right thing. They go sleep on their stomach, but then they roll at night and they roll onto their hips or their butt. So a way to prevent that is put pillows around you. Yeah, I'll see people where one hip is a little flatter because they would roll onto it at night. They're not trying to, but when you're sleeping,
but naturally you just do it.
So you put pillows around you to prevent that. You want to make sure you eat lots of protein. That new fat needs, that protein to heal, but the protein also gets the swelling out because it sucks the fluid out and then you pee it out. So protein really helps with that. Another thing I want to say while we're on here is get your drain out before you leave Miami. I tell every patient this, but they not never. Some of them don't listen. They go back home, they call and they say, I can't find anyone to take the drain out. So that's why you want to get the drain out before you leave Miami for the lipos and BBLs. Tummy tuck is a different story, but we're not talking about that right now.
Why? So my friend she's about to have surgery. She's like, I've never had a drain, and they're insisting on this is the only way that they do it with the drain. So, I've never had a drain, doctor. You've never given me one, and I don't want you to ever give me one.
So I don't force them upon patients for the lipos and BBLs. Again, tummy tuck's a different story. For lipo or BBL, I don't force it upon you. It does help with the swelling, though, because it gives an easier path for that fluid to come out. That's why I put them in. It helps the swelling get out quicker. If a patient doesn't want to drain, they can tell me they don't want to drain. I won't put it. But I do think it helps the recovery. The only problem is getting it out. So it doesn't hurt to get it out. It's not hard to get out. But for some reason, when patients leave town with it, they just have a hard time getting it out. So that's why I like them to just come in here. We'll, the nurses here on the 3rd floor will take it out for you whenever you want. Yeah. And that we don't have to worry about it.
Oh my God. What kind of pain management strategies are typically employed during the initial recovery of a BBL?
Sure. So we do give opioids, and I only want you taking these for the first few days after surgery. By day 3, maybe 4, you should really not be on the opioids anymore. You should be switching to over-the-counter Tylenol on Aleve. There's like a Tylenol arthritis, which lasts about 8 hours, and Aleve, which lasts about 8 hours. So if you take those two together, as long as you don't have any kidney or liver problems, you can take them together every 8 hours for a couple of days, and they'll kind of give you this baseline pain control, and then you can slowly start coming off that too.
Yeah, because I get the drugs, and usually after surgery is when I feel the craziest. Mm-hmm. So I'm like, get the drugs in me so I can get a good rest.
Right.
But once I get a good rest, the next day I'm on Tylenol extra strength.
Good.
Yeah, I don't usually because I don't want to become addicted and start liking how it feels. Mm-hmm. And then I also feel like I don't really need it. If I don't have any pain, I'm not a person that's going to persist to take pain meds.
And what you just said there is actually very important. We used to be taught, and this is all coming out of these lawsuits now, that we used to be taught that if you have pain, you take pain medicine, you won't get addicted. That's not true. And that's why I try to stress to my patients that I don't want you taking these opioids too long, because you actually can get addicted. And, as we're all seeing this opioid crisis, that is a big problem.
Yes.
So I do like patients to switch off the opioids as fast as they can and switch over to over-the-counter medicines.
Yeah. I usually have, I'm not recommending to take them after the prescribed, space, but I usually have some left over because the whole thing, because I don't take them. Right. I take them for the first 2 days, and then I'm on the Tylenol extra strength.
That's good. And, it's hard to know exactly how everyone's going to react to pain. That's why we do kind of give this set amount. Mm-hmm. But I don't want people going beyond that. So a lot of times patients will come in and say, hey, I need more opioids. And they're like, a week after surgery. I'm like, no, I'm not doing that. I don't want you taking opioids anymore. You need to switch over to over-the-counter.
Yeah. You mentioned you like your patients to walk immediately after and to get the blood flowing, the heart rate going. What other specific activities or movements could assist in, the first few days of a great, healing?
Oh, that's a good question. Let's see. Besides walking around, so it kind of just depends on what surgery you're doing. Because if you're getting a tummy tuck, I don't want you doing a lot of bending or things like that because that could hurt it. If you got a breast surgery, I don't want you moving your arms a lot. But just movement in general, as long as it's not contraindicated in the surgery you got, any kind of movement is good. If you want to dance, if you want to walk, if you want to jog, maybe not run, just movement in general, getting your body up, getting out of bed. It's just that kind of being that slug laying in bed is what's bad for you.
What signs of potential complications should a patient watch out for? You mentioned the blood, the difference between it. That's just the fluids. That's not blood. The consistency is different. But what other?
Sure. So immediately after surgery, most patients will have a fever the first 2 or 3 days. That's normal. But if it's been, 5, 6, 7 days and you didn't have a fever and now you're starting to get a fever, that can be worrisome that maybe you're developing an infection. If your butt wasn't having pain, you got a BBL, but now it's starting to develop pain. Again, it's been over a week or so and you're starting to develop new pain or you're starting to see new erythema. Basically, if you're seeing things that weren't there the first few days after surgery, for the first 3 to 4 days, most things are going to be normal. Bruising, pain, swelling, all of that is normal. There are certain exceptions to that. But, if something that started a week after surgery, that might be something to worry about because that wasn't there before. So that could be an infection brewing. Things that happen immediately that are extremely rare is sometimes you get a hematoma, which means a blood vessel is bleeding. It's extremely rare with a BBL, but what that would be is if you start seeing something suddenly growing very fast. That would be a sign of a hematoma. But in general, for most of these surgeries, complications are fairly rare.
Fairly rare.
Yeah.
I know you mentioned briefly that when it comes to dietary recommendations, eating a lot of protein sucks up the fluid. But what other dietary recommendations do you have to a successful post-surgery, like the results?
Sure. So just a healthy diet. A lot of people say Mediterranean diet or some offshoot of that. Basically what that's saying is that you're eating real foods. You're not going to McDonald's to get your food.
Fast foods.
Right. You're eating real foods. You're not eating a lot of sugar. Sugar is also, as we all know, is not good for your body. It impairs healing. It impairs the swelling coming out. It kind of just hurts you. It's a toxin, just like anything else. So you want to avoid sugars, eat lots of protein, eat lots of real food.
When should a patient see initial results? Like, what's the time frame, that they should expect to be able to start seeing results? Because everybody thinks that they're gonna just hop off this table and look like what they gave as their wish pick or what their ideal space is. Like, even me, you just recently did lipo on my arms and on my back. Mm-hmm. And even though when I freshly take off that faja, it's flat, it's everything, like, okay, this is what I wanted. After a couple of hours, I'm like, okay, this is not looking like...
Why are you out of your faja for a couple hours?
No, well, in cases like this, like right now, I don't have it on.
I'm kidding.
But I mean, like for those small minimal hours,
right?
I'm itching right now to put it back on. Right. I can't wait. But the swelling comes back.
Right, and that's an important point. So the first 3 days, your swelling really gets the worst, but it takes about 6 weeks before you really stop seeing the swelling still gathering. And then after that, depending on your body, it can take anywhere from 6 to 12 months for the final result to show, because everyone's body is a little bit different in how fast it recovers. And so that 6 to 12 months means that your body's getting rid of it. So 6 weeks, you lose about 70% of the swelling that you initially had. And then that last 30% can take that 6 to 12 month period. But you should see your initial results around 6 weeks, and then your final results, I would say, around 9 months.
9 months. Drink lots of agua.
Mm-hmm.
Lots of agua. Are there any specific post-operative garments that typically you recommend? Like, I know we just spoke about the faja and wearing it consistently, but I know that you also recommended me to wrap up my arms a little tighter, or even the arm sleeve being a little smaller than usual.
Sure.
Not to cause blood clots, of course, but a little smaller than I guess my actual faja is. What I do is I have a faja and then I have an arm sleeve that's smaller. So if my faja is an extra large or a large, my arm sleeve I bought is a medium.
So that's a good way to do it. Yeah. So for the extremities, if you get arm lipo or thigh lipo, I often recommend that patients do an additional wrap over that or use a tighter sleeve. The reason is that, the faja just doesn't provide enough compression. And so for the arms and the thighs, I want you to wait until day 3. But after day 3, when that initial really bad swelling has now happened, you want to wrap it not so tight that your hands and feet are going numb, but almost to that point. So if you're feeling numbness, it's too tight. Loosen it up a little bit. But that tightness really help with reducing the size of the arms, reducing the size of the thighs. Because obviously the reason you're getting the lipo is for that, but the swelling doesn't go away as quick as it does in other parts of your body. So that wrap really
Arms
helps.
take a little bit longer?
They do.
They do. What is some wound care that you can give to a post-operative patient during recovery?
Sure. So with lipos and BBLs, there's usually not a whole lot of wound care that's needed. But if for some reason a wound does develop, this is more common in open surgery, especially if you do like a breast lift with implants, because there's going to be a lot of pressure on the incisions. If wounds open up, they usually open up around 3 weeks after surgery. And then it takes about 3 to 4 weeks for, they open up around 3 weeks after surgery. They continue to open for another week or two, and then they start to heal over another 3 to 4 weeks. It's kind of a standard for wounds opening up. And if that happens, what I tell patients is just wash it with soap and water and put a little bit of Vaseline on it, and it'll heal. Same thing with other wounds. The best thing is just that soap and water. If it's an open wound, it's not really sterile. So that soap and water really helps to come in, wash out all the things. And the Vaseline gives a nice environment for the wound to heal. You don't want a lot of Vaseline, a very thin layer. That'll help with that. Another common thing I hear from patients is sutures sticking out. Almost all the sutures I use dissolve, but sometimes your body just isn't dissolving it well. So one way to get rid of it is you can take nail clippers and just clip it down to the edge of the skin. Or if it's looks like a tiny little pimple, if it's been 3 to 4 weeks since the stitch was put in there,
you can go ahead and pop it.
You can go ahead and pop it. Yeah.
What advice? What advice would you give regarding like sleeping positions and posture to early recovery?
Yeah. So for BBLs, the way you need to sleep is on your stomach with a bunch of pillows around you. You don't want you rolling around. For lipo, just sleep however you want. That's most comfortable. For tummy tuck, you want to sleep with your head a little bit elevated and then slowly go down to flat. And those will all help with recovery. If you did some chin lipo, it does help to have your head a little bit elevated to get that swelling to go down. And if you have, a lot of lipo, maybe sleeping in a reclined position to get some of that swelling out as well.
What do you recommend for sun exposure and, scar care during the recovery?
Right. So if you had an open surgery, like a cutting surgery, like a tummy tuck or breast reduction, things like that, those scars are very sensitive to light. You want to have them covered for 6 months. If you absolutely can't cover them, then you want lots of sunscreen, or you want something like some kind of silicone gel patch. There's things like ScarAway or Bioderm and things like that have, they're either opaque, meaning the sun can't get through, or they have sunscreen in it to prevent that. Because if you get too much sun on a fresh scar, it'll be a different color than your surrounding skin. Because they're fresh cells, they're just learning what to do with light. And so if they're getting too much light, they're going to react different than the rest of the body has.
Is there any way to reverse that?
So there are some lasers that can help with it, some CO2 lasers or fractal lasers, which unfortunately we don't have here, but a lot of your local dermatologist or plastic surgeon might have. You can also inject steroids into it, but you have to be careful if you're darker skin like you or me, because the steroid can make the scar whiter. So, if you are having some trouble with your scar and you talk to your dermatologist, they should be able to help guide it. But lasers and steroids are usually the mainstay for that.
How long, because I had a breast lift, how long before you can start those processes when the breast heals?
So for the silicone gel, I want you to start that around 3 weeks after surgery, which obviously it's long after where you are. But for the lasers and the steroids, the lasers you can usually start. If it's really bad, you can start at 3 months, but for most patients, I'd say 6 months.
6 months.
And the steroid, if you're prone to keloiding, you can start that around 4 weeks, 5 weeks. But again, something you want to do around 6 months.
So, can you discuss any potential emotional and physical, psychological recovery and aspects of like when when I have surgery after BBL, sometimes I'm really emotional. I'm crying. I'm doing all these things. And, yesterday I got to sit with Dr. J.C. Alvarez, and he talked about these chemicals and the anesthesia and all these things. Your hormones are imbalanced. And so you may find yourself crying for no reason or things. So can you talk on that?
Sure. So surgery is a stress in your body. If you think about it, I am cutting you open. I am attacking your body as how your body sees it, right? So when you go through a trauma, your body is going to respond to a trauma. It's going to have that fight or flight reflex. And then once everything's settled down, those stress hormones are going to be very high because, again, you just went through a trauma. So everyone reacts a little bit different to that stress hormone. For you, it was to feel depressed. Other people might feel really anxious. Everyone just responds a little bit differently, but you do have a flood of stress hormones in your body, and that is what you are responding to. And so when he talks about that imbalance of the hormones, it's those stress hormones. And so, it's always good to have support around you, someone that can help calm you down or someone that can just help you get through it. It's also good to know that you're coming into this so that when you start to feel this, you're like, oh, I'm not depressed. It's just how my body is reacting to this. So if you are aware of it, then it does help you get through it. But having someone there or just knowing yourself,
support system,
exactly, does help you get through it.
Doc, the question everybody wants to know: when can you resume sex?
Yes, this is a common question.
And when you resume, what are the positions that yesterday, Dr. J.C. Alvarez, he was telling me about some common sutures positions that might work. While you're recovering, but I want to know what your take is on, like, how soon, what are the positions, and what is your take on this?
Again, so it kind of depends on the surgery you're having, but I think since we've been talking about BBL, we'll focus on that. I like patients to wait around 6 or 8 weeks after the BBL before really having sex, because of the pressure on the butt. And then around the 6 to 8 week mark, if you're going to start having sex, I want you to do positions that aren't putting a lot of pressure on your butt. So most commonly that's going to be the girl on top, and kind of doing that position, because then you're not really, you're not putting the pressure on there. Cowgirl, yep. And so at 3 months, I don't care what you do. At that point, you're free to do whatever you want. But before then, just try to find ways that keeps the pressure off it. So things that wouldn't be good would be something like doggy style, because that's putting a lot of pressure.
A lot of pressure on that back piece.
Or missionary, because the girl's lying on her back.
And if you're a girl like me who smaller waist and a bigger bottom, there's an arch in your back that's like, it's even more painful to lay on your back because that space is there.
Exactly.
I tried to hold off as long as I could. I know the men, they're so anxious because you have this new body and they're ready to get back to it. But I recommend, I keep saying and stressing, ladies, do it when you're ready. Do it when the doctor recommends it.
And there's other things to do before you get there.
There's a whole lot of other things to do. We have multiple spaces on us, ladies. Get creative.
Exactly.
I love that. What are some tips for safety and comfortability using the bathroom? I know, like with my faja, I love the one that zips all the way up to the butt crack, because that way, if I have to do number 1 or number 2, and I recommend ladies to have baby wipes because the tissue is not enough.
Right.
And so that's how I kind of.
That is a great point. Yeah,
business.
if you can keep your faja on and still do it, that does help, because that way you're not, breaking the compression. It is a little bit difficult going to the bathroom because it's a balance. If you put too much pressure and you're sitting down, I've seen patients where you can see the shape of the toilet seat in their butt because they sat there too long. So you want to be quick with your business. You want to, if you have the strength or if you have handlebars next to the toilet, to kind of push off, so take some of the pressure off your butt. Or maybe just don't use the toilet seat, have the toilet seat up, and that always sits a little bit skinnier, and you can try and levitate over it.
Right.
It's difficult. I'm not saying it's easy, but these are anything you can do to try and keep the pressure off. So usually the best way, though, is kind of those handicap bathrooms that have the handlebars. That lets you push off a little bit.
What is this thing? Because I had a BBL, thanks to you. And my biggest thing was, even after healing, after like a few months, I would find even like into like 6 months, if I'm sitting for too long, I feel like my butt is going numb.
Sure. So this is common. If you think about it, I'm putting a lot of fat in your butt, right? So that's a lot of extra pressure that's going in there, and it takes time for the body to accept that fat and then turn into its own. So until it really softens, you have all of that extra pressure, and there's only a limited amount of space in there, so the nerves are also going nearby. They're not right where the fat is, they're deeper, but the force being exerted is pushing on the muscle, which is pushing on the nerve. And so if you think about it, if it's already tight and then you put more pressure, it's going to make that nerve go to sleep.
Yeah, because I had this period where I was healed. I'm good. I'm going. Life is back to normal. And then I had the moments when I was sitting for too long and literally even sleeping on my back became uncomfortable. Like I'm like, I had to go back to the old ways. I'm like, I gotta sleep on or if I was moving around, even after being healed, I was moving around all day one day. And when I got home, it felt so good to lay on my stomach and just give my butt a rest.
So, but that probably, once your butt started to soften, those symptoms started to go away, right?
Yes.
It was why you still had that high pressure in there that you feel that once this starts to soften, once the swelling goes down, once the fat has taken and your body has accepted it and everything's gotten better, you start to see that go away.
I took my pink little BBL pillow everywhere. I couldn't sit still for long enough. And my friends were inviting me. I'm like, why does everybody all of a sudden have invitations for me everywhere while I'm trying to heal?
Right.
That's always the time everybody wants to invite me outside. But I said, listen, I'm coming. Mama got to come outside and play. I need some fresh air.
Of course.
And so I got dressed. I always find garments that can cover my faja so I'm still able to be compressed while I'm outside. Yeah. But I went to the nightclub with my little pink BBL pillow, and I did not care who was staring. Listen.
It's a fashion statement now, right?
It is, because you wish you could.
Exactly. Oh, another way for people to go to the bathroom. I forgot about this.
The funnel.
Yeah, the funnel.
The funnel. I'm a little clumsy. I told you my eye and hand coordination is terrible.
Right.
I might pee on my hand. I don't know.
But that's the whole point of the funnel. Is it like creates like a little suction cup around it?
You gotta hold it there.
I mean,
I don't know. Right. All right. Okay. Well, I haven't had much experience of it, but I would assume that I have to hold it there.
So I just went to Oktoberfest with my family, and as a joke, I bought my sisters that because you're drinking a lot of beer.
Right.
I don't know if they use it or not, but yeah.
We'll check back
it looked
in.
like it should be straightforward.
Dr. Nosrati sisters, let us know if you used the funnel and how it worked out for you.
Awesome.
We're aware that a lot of patients travel from all over the world and the country. Could you share some of your top recommendations for traveling for patients who come from afar?
Sure. So first thing is, travel just with comfortable clothes. Bring things you want to be comfortable. Like when you're packing, don't be packing some spandex dress that you're not going to wear, right? You want something that's easy to get in and out of, mostly robes or mostly very loose-fitting clothing. Yeah. You want to stay long enough, too. All the time patients come, they're like, oh, I'm leaving tomorrow. I'm like, no, we're not doing your surgery if you're leaving tomorrow. You want to stay for a while, at
least 4 to 5 days.
Yeah, exactly. At least 5 days. The longer, the better. Think about it. If something happens and you're halfway across the country, how am I going to help you?
How am I going to do anything?
If you're here, I can help you.
Right.
But also, you're just not going to feel well to travel the next day. So you want to stay long enough that you can recover. You want to bring someone with you or have someone here that can take care of you. You don't want to come down here and the people you bring is your 3 infant children, right? They can't take care of you. You want to come with someone that can take care of you, someone that can help you get around, that's strong enough to help you walk those first few days. And then maybe bring some food with you. I saw a video, I think maybe you talked about this, that you prepared some food beforehand.
Yeah, meal prep.
Because that helps. Yeah, if you meal prep or you buy that food beforehand, then you're not trying to figure out, where to eat when you're also in pain and trying to recover.
And we all know that we make bad decisions when we're making decisions very vastly.
Right.
So it's better when you prepare this food. You had time to think about what's going to really help heal my body and give me this speedy recovery. For me, when I come into town, I usually stay about 4 or 5 days. Mm-hmm. I'm not hopping back on the plane while I'm still leaking.
Yes.
So if I'm still leaking, I'm definitely not getting back on the plane. It's just too much work. It's too messy. Mm-hmm. It's nasty. You got to worry about now these red spots leaking through your clothes, and it's embarrassing amongst other things and uncomfortable. So I like to stay at least 4 or 5 days. Once I stop bleeding, and once I've gotten my first 2 or 3 massages, I'm ready to go. Yeah, and then when I'm on the plane, I always make sure that, if you can't afford first class, I understand. But I recommend if you're doing long flights, I'm only in New York, so my flights are only like 2.5, 3 hours. But for somebody going further, maybe back to the West Coast, bring you the BBL pillow, bring you a soft cushion and a blanket. My favorite position after my BBL was once the plane took off and it was safely said for me to take off my seatbelt, I get on my knees. Yep. I put a cushion under my knees, a cushion on my tummy and my head, and that's how I lay on the plane. And don't worry about being embarrassed, guys. Everybody knows what's going on.
Right.
9 times out of 10, they're going to ask you who your doctor was, who your surgeon was, how much you paid, how much pain you in, because they're trying to prepare themselves for the same journey.
Absolutely. And then the other thing when you're on the flights, especially the longer flights, is I want you getting up every 30, 45 minutes and walking around the cabin.
And walking
You don't
around.
want, I mean, people going on long flights are already at increased risk for
Blood clots.
Right? And now you're adding a surgery to it, so your
Yeah.
risk is going up more. So I want you walking a lot, but also it's taking pressure off your butt every time you're walking around, right?
Yes.
I mean, it is nice that you're sitting on your knees. That's how I want people flying, but your knees also get tired.
Yeah,
So
they
get
do.
up and walk around, give your body a break.
And those compression socks. Make sure you
Yes,
guys have on
absolutely.
the compression socks when you're on the plane. Even after I had surgery October 10th. When I'm on the plane, though, I still put on my compression socks.
Right.
I'm not so much sleeping and walking around with them anymore. But on the plane, I definitely put them on because I can feel when we do get off the plane, my legs are super tight.
Right. And you want to wear those compression socks for a couple of weeks after surgery, especially if you're having something like a tummy tuck, which is higher risk for clot. Those need to stay on for at least 3 weeks because you are, it's a big risk right there.
Doctor, you're so amazing. I've never had any complications with you. I think I had a scare one time when I was just like, my right boob is hot. I don't know what's going on.
I remember that. I remember that conversation.
I've never seen this doctor. What's going on? He's like, don't worry.
But that's the right thing to do.
Yeah.
That's a new symptom that you weren't having before. So you contacted us. We talked it through it and you turned out to be fine.
Yeah, I turned out to be fine. I love sharing tips and tricks with you because even though he's a doctor, I'll be doing my research. I'll be like, Doc, I found this new oil. Is this right? Like, he's either going to tell me yes or no. You actually complimented my book, my self-help guide book.
Yep.
I'm not a doctor. And so I'm not trying to give professional advice, but I definitely talk from my standpoint and my
You've been through the experience. You know what it goes through. You know what the troubles were, what the difficult things were. You know how to handle it. You figured out the best way to handle it. And it's good to share that.
Love that. What's the most unexpected question you've received from a patient regarding their plastic surgery recuperation?
I think I had one patient ask me something about like when she can start using crystals for. It was so out there that I just stared at her for like a minute. I'm like,
wait, what was the question?
I think she wanted to. She was using crystals for healing, and she was asking when can I start reusing my crystals. And I was just like, I don't know what to say to you.
Right.
I don't know how to answer that.
Because she's into the whole spiritual thing and healing from crystals.
I guess I literally had no answer. I
feel like she could have never stopped and we wouldn't even know.
Right. I mean, I was like, I'll do some research, see if there's any medical articles about crystals and healing.
That is so funny. The Road to Recovery with Dr. Nosrati, the BBL master himself, double board certified. I just had to reintroduce you and let you know who I'm sitting. I'm sitting here with the guru himself. Listen, we have a multitude of amazing plastic surgeons here. Dr. Nosrati, you have become my favorite. You have made my journey.
You're one of my favorite patients too.
Thank you so much. You don't have to butter me up. You have made my journey with plastic surgery so pleasurable. It actually brings a tear to my eye because I just love what you do. I love how much you love what you do.
Thank you.
And this is why I always choose New Life Plastic Surgery because of you.
Thank you.
And just the way they work here, the way that they just respond, and like we have become a family at this point. And so, listen, we're on Plastic Surgery Tales at New Life Plastic Surgery. I am your host, Holiday, the Golden Child, and we're with Dr. Nosrati. Before we get out of here, Dr. Nosrati, any last words, any last advice that you have for the people who are looking to get plastic surgery and come to you?
This is all about you. I want the patients to tell me what they want and be excited, be positive, know that this is a transformation that's supposed to be helping your life. Just come in with a great attitude, and I think you'll leave with a great attitude.
Thank you so much, Dr. Nosrati. Make sure you guys, before you get out of here, like, share, comment, repost. If you have any questions for Dr. Nosrati, you have any questions for me, make sure you guys don't be scared. Slide in those comments, slide in the DMs. We're answering everything. Listen, the point of Plastic Surgery Tales is to tell more than just one tale. We're here to answer questions. We're problem solvers over here. I can say that. And while we're solving problems, we're almost like superheroes. You're considered a superhero. So before we get out of here, if you had one superpower that you could have, and you said, what was it again?
I think we went mind reading or immortal.
A mind reading. Well, he's definitely, I think they gave you that superpower, Dr. Nosrati, because you definitely read my mind every single time and you give me exactly what I want and you execute it to the T. Guys, Plastic Surgery Tales, Holiday the Golden Child, Dr. Nosrati. We're out of here.
It's always a pleasure. Thank you so much.
Yes.